Assalamu alaikum. I'm Dr. Sikandar Memon. So you have already registered for this program. Now you have to pass 12 modules to get this certification. Okay, for that certification, these modules are in depth. So we are just going to give you some superficial view for all the modules. So you will just have an idea how to attempt those modules each one by one. And at the end, once you are done with those modules, you can attempt all the basic Qs and you will get the certification for this thing. So the first in this, the first module is IRB, Institutional Review Board. Understanding the role of Institutional Review Board, IRB in clinical research. Do you have any idea what is IRB, by the way? Any one of you? Yes? Yes. Any idea? What is IRB? You are working in Pakistan and you want to conduct any research. So how you are going to perform that research? Any idea? Yes. For example, you are an undergraduate student or you are a postgraduate student. So how you are going to perform that research? Yes. Proposal. And how do you think that proposal is going to proceed with it? So you are going to send this proposal to REC or ERC. In our country, we are calling it Ethical Review Committee, right? Internationally, we call it IRB. IRB stands for Institutional Review Board. So any study, once it has to go through this IRB for the approval to get approved, then you can proceed with data collection and all the studies. So in clinical practice, in clinical research, you have to send your proposal to IRB. So first we must know what is IRB actually. What is IRB? An Institutional Review Board, commonly known as IRB, is an essential component of clinical research. The structure of an IRB. It is an independent body responsible for overseeing research involving human participants. How it regulates? Any research funded by federal agencies, institutions, or all the universities, they have to undergo IRB review before proceeding with the research. So, IRB authorities and responsibilities. An IRB has a specific authority over the conduct of research within its jurisdiction, which include the power to approve, disapprove, or terminate research. Activates within the purview based on federal regulations and institutional policies. It required the demand that participations are provided with additional information to make informed decisions. It insists on documentation of informed consent or grant a waiver of documentation as appropriate. What happens if you do not take the ethical approval letter? No clinical study can commence enrolling participants until it is received approval from the IRB. So what is the purpose of IRB? It safeguards participants. It reviews the research plans to fulfill the purpose. Continuing their research procedure, they do not expose participants to unnecessary risks. Conducting continuing reviews to ensure the ongoing safety and well-being of participants, monitoring adverse events or relevant literature. Membership of an IRB. So you must have an idea that how the what kind of the dignitaries or the researchers they get the members of this IRB. There is diversity in the membership. A fundamental requirement of an institutional review board is a diversity in its membership. The component of an IRB should reflect a wide range of perspective and expertise. Selecting members. The selection of an IRB members is critical. Members should be chosen based on the qualifications and experience in various relevant fields. Scientific and non-scientific backgrounds. Now you see, there are sometimes the people who are being the part of this IRB, they are from expertise in the field of, concerned field of scientific. But sometimes there are some fields which are not non-scientific fields. So we also have to get the members from the non-scientific fields as well. Avoiding conflict of interest. Do you have any idea what is conflict of interest? Anyone? Yes? Yes, what is conflict of interest? Anyone? Yes. Conflict of interest. This is a word which we use, we are hearing every day when we are looking at the proposals or the articles. This term we always come across with. Yes. So what is conflict of interest? Anyone? Anyone? Copyrights? What do you mean by copyrights? Okay, it's one part you can say. Anything else? Yes? Yes?
अपने तरह के रिजल्ट्स मतलब परसीव कर रहा होता है कि वो रिजल्ट्स को थोड़ा मोल्ड करके वो प्रेजेंट कर ले अपने मतलब प्रेफरेंसेस वो आगे रख के रिस्पॉन्स जो रिसर्च की रिस्पॉन्सिबिलिटीज है उसकी मतलब
So you are saying sometime it's kind of bias, right? Anyone else? Plagiarism, okay? Anyone else? Okay. Now you see, to maintain the integrity and impartiality of an IRB, it is crucial to avoid conflict of interest among its members. Conflict of interest arises when an IRB member's personal or financial interest could compromise their ability to make their objectives, decisions regarding a research study. If they are biased towards any project, if they are directly or indirectly involved in any research, it could produce any kind of bias. So you have to avoid the conflict of interest. Guidelines for members. Members must recuse themselves from the review of any project in which they have a conflicting interest. They may only provide information when requested by an IRB. So the responsibilities of an IRB is the provision of infrastructure, means a place where they can have this meeting for the IRB. Like in our university or in any university, they have this board where they perform these all kind of IRB meetings. And then a full study plan review. For example, you are providing the proposal. You see, आप लोग एक project बना के देते हैं किसी भी IRB को, या आप जैसे यूनिवर्सिटी लेवल पे जो स्टडीज़ करते हैं, क्लिनिकल ट्रायल्स हो या ऑब्जर्वेशनल स्टडीज़ हो, when you are performing those studies, तो आप कैसे proceed करते हैं? How do you proceed with them? Yes. देखिए, आप एक प्रोजेक्ट बना के देते हैं, किसको देते हैं वो प्रोजेक्ट? उसकी कोई there are some guidelines for the projects and you are providing that project towards, you are submitting to REC, Research Ethics Committee, right? It's the second name of IRB. IRB is Institutional Review Board, which we are using generally internationally. So what happens when you are providing this proposal to any university, in any organization, or for the purpose of conducting any research? Yes, बताएं उसमें क्या होता है? आप जब उसको प्रोवाइड करते हैं, उस प्रपोजल में क्या चीजें होती हैं? You see, proposal is an idea of your research, right? So you are giving a documented form. The ideas you are providing in documented form. So you must have introduction and these all basic things, your basic objectives, and then you are providing whole methodology. So this methodology could compromise. Sometimes they could include the fetus or the pregnant women or the patient who are invulnerable. So they have to review it clinically so that you are not providing any risk, you are not causing any risk towards those patients, right? So the responsibilities of an IRB also, the other responsibilities of an IRB is continuing review, informed consent evaluation, risk assessment, review of conflict of interest, prompt communication, safety monitoring, record keeping, training and education. And suddenly an IRB plays a pivotal role in overseeing the ethical and safety aspects of clinical research. Their responsibilities ensure that research is conducted in a manner that protects the rights and well-being of research participants. So the criteria for IRB approval of research: minimizing risks, responsible risk to benefit ratio, equitable participation selection, informed consent, data privacy and confidentiality, safeguard for vulnerable populations. So the Belmont report criteria guide IRB making decisions. Do you know what is Belmont report? Anyone, any idea? As a doctor, as a medical student, as a researcher, you must know what is Belmont report. Do you have any idea what is Belmont report? It is a fundamental document that in the field of research ethics and human subjects protection, it was created by the National Commission for the Protection of Human Subjects of Biomedical and Behavioral Research in the United States. It was published in 1979. The Memon report outlines 3 core principles. Those are: 1, respects for persons, means the subjects. Number 2, beneficence. The principle requires researchers to maximize potential benefit to participants and minimize any potential harms. Number 3, justice. It emphasizes that the selection of research participants should be equitable and that no particular group should bear an unfair or disappropriate share of the research risks. So, as a investigator's responsibility, when you are submitting your proposal to any IRB, you must go through the submission of necessary documents, prompt reporting of protocol changes, adherence to approved protocols, ensuring informed consent, monitoring participant safety. Responding to IRB requires completion of continuing reviews. These responsibilities help maintain the integrity and ethical standards of research process. So these are the takeaways. You just go through these points and then we'll finish this IRB module. These are the takeaway points. Please just go through these points. If you have any questions, you can ask me, please.